Diverticulitis, presented by Suzette Emberton, Jeffrey Framnes, Caitlin Gavos, and Rebecca Hamblin. Our patient for this case study is Tanner Harper. He's a 57-year-old stockbroker who smokes a pack of cigarettes every day. For several years, he had 2 to 3 mixed drinks every evening, but he hasn't had any alcohol at all in the past 60 days as he's trying to stop drinking. Tanner says he's very busy with his job and doesn't have time for regular exercise. His diet consists mostly of white bread, meat, potatoes, and ice cream with fruit and nuts. Notice that this is really low in fruits and vegetables and fiber, and high in starch, sugar, and fat. Tanner has mild obesity, but he's never had any serious injuries or illnesses, no known drug allergies, and he has no history of cardiac or pulmonary problems. He has no personal history of cancer either, although his father and elder brother died of colon cancer, so this automatically places Tanner at an increased risk himself. Finally, Tanner denies regular use of medications and other drugs. Tanner's going to the doctor because he's been having some gastrointestinal problems. When he gets to the clinic, his blood pressure, pulse, and respiration rate are elevated, which consists that he's in pain, and also he's sweaty. His temperature is elevated at 100.4 Fahrenheit, which suggests that he has an infection or inflammation somewhere. Tanner says that he has recurrent mild to severe abdominal cramping, he has blood in his stool, and occasional constipation. At the doctor's office, Tanner is having some abdominal pain and tenderness. He's guarding his abdomen, and he has direct and rebound tenderness on palpation. The pain for him is worse in the lower left quadrant. The doctor suspects that Tanner may have diverticulitis, and so he or she orders these diagnostics in labs. We have an x-ray of kidneys, ureter, and bladder to rule out a problem with the urinary system. There's a complete blood count. An elevated white blood cell count would be consistent with inflammation or infection. We want a complete metabolic profile to check Tanner's liver function. We want to look at liver enzymes. His long-term alcohol use puts him at risk for alcoholic liver disease, and also it's not uncommon for someone with diverticulitis to also have dyslipidemia. The doctor also orders a fecal occult blood test. Blood can appear in the stool for a variety of reasons: malignant or benign growths or polyps, hemorrhoids, inflammatory bowel disease, intestinal infections that cause inflammation, or diverticular disease. It's also important to note that a false positive can occur if the patient has eaten a large quantity of red meat in the past 3 days. And Tanner says he eats a lot of meat, so we have to keep in mind that a false positive is actually possible. Based on the physical exam findings and laboratory tests, the physician diagnoses acute diverticulitis. So what is this? Diverticula are marble-sized pockets of epithelium that herniate from the GI tract, especially from the descending and sigmoid colon. You can see the graphic here on the screen that shows what these look like. In the United States, approximately 40% of people age 60 and older have diverticula, and 60% of people age 80 and older have them. Most of the time, these are completely asymptomatic and benign, and that condition is defined as diverticulosis. Diverticulitis occurs when the diverticula become inflamed or infected. And even though it's pretty unusual, it is possible for a diverticulum to tear. Symptoms of diverticulitis include pain in the lower left quadrant, like Tanner reported, nausea and vomiting, fever, which he had, constipation, which he reported, and diarrhea, though that's less common. Risk factors. Well, the risk increases with age. Obesity is a risk factor, so is cigarette smoking, lack of exercise, high-fat, low-fiber diets, and use of certain medications. Note that Tanner has every single risk factor except the medicines. It's also interesting to note that in underdeveloped countries, diverticulosis is nearly non-existent, strongly suggesting that the typical American diet, sedentary lifestyle, and resulting infrequent bowel movements are causative. So common complications of diverticulitis. 1 in 4 patients will have at least one complication. The common ones are abscess, GI blockages from scarring, or fistulas from diverticula to other bowel sections, or even to the bladder. The most serious complication is peritonitis, and this is an infection that can occur when a diverticulum ruptures and intestinal contents start to leak into the peritoneal space. This is a big emergency because it very easily leads to sepsis. The rupture has to be repaired surgically, and it needs to be done as quickly as possible. Common comorbidities: obesity, dyslipidemia, diseases that are treated with corticosteroids like arthritis, lupus, or multiple sclerosis, or conditions that are commonly treated with NSAIDs like arthritis or musculoskeletal conditions such as back pain. The way diverticulitis is treated depends largely on the severity of the symptoms. Tanner's case is mild, and he's able to be treated as an outpatient. He's given antibiotics. He's put on a clear liquid diet for ease of digestion and hydration. The doctor suggested he use an over-the-counter analgesic for pain. They're probably going to recommend that he use acetaminophen because ibuprofen and aspirin are NSAIDs, which can actually contribute to the diverticulitis. And he's also told to spend 1 day just resting in bed. When diverticulitis is severe, the patient may need to be hospitalized. They get IV antibiotics or have an abscess drained. Or sometimes surgery is needed. We said earlier, if one of the diverticulum ruptures, that has to be repaired surgically, and patients with compromised immune systems may need surgery as well. And also, surgery may be required for patients whose symptoms aren't resolved by the more conservative treatment that Tanner is using. The common surgical procedures are primary bowel resection, in which diseased parts of the colon are removed and healthy parts are reconnected, or a bowel resection with colostomy. An opening called a stoma is created in the abdominal wall, and this is connected to the healthy part of the colon until inflammation reduces enough for the bowel to be reconnected. Tanner's been given some prescriptions to help him. The first one's Flagyl. It's an anti-infective. It has some GI side effects. And also important for Tanner to know is that his urine may turn dark reddish brown. That does not mean that there is protein or blood in his urine. This is just from the medication. But he should notify the prescriber if he has numbness or tingling in his extremities. And he needs to be sure to completely avoid all alcohol, even mouthwash. If you consume alcohol while you're taking Flagyl, you could have a serious interaction called a disulfam reaction. This causes the patient to become violently ill with tachycardia, headache, and severe nausea and vomiting. Another drug he's given is Bentyl. It's a gastrointestinal anticholinergic. It blocks parasympathetic stimulation and slows natural movements of the guts. So the side effects are similar to those of other anticholinergics. He has drowsiness, blurred vision, dry mouth, nausea, constipation, and abdominal bloating. Tanner also needs to know that this drug can reduce sweat production and lead to heat stroke, so he has to be really careful in hot water. If he's going to be out, he has to stay well hydrated, and it would really be a good idea for him to not be outside in the heat any more than absolutely necessary until he's finished with this medicine. And finally, he's given Augmentin, which is a broad-spectrum antibiotic. This one also has GI side effects. As with any anti-infective, Tanner has to make sure that he completes the entire course of the medication, that he doesn't stop taking it just because he feels better. He should notify his doctor if he has a sore throat, fever, or fatigue, because this suggests that he may have a superinfection or a granulocytosis. He also needs to report diarrhea, cramping, or blood in his stool, as this is suggestive of pseudomembranous colitis. Notice that every single one of these drugs have GI side effects, so the nurse should be sure to explain to Tanner that all of these medications may cause him to feel worse for a short amount of time before he begins to feel better. And the feeling worse would not be because his diverticulitis is getting worse, it's just the GI side effects from these medicines. And now this brings us to nursing considerations. First nursing diagnosis we have is constipation related to diverticulitis, as evidenced by patients' reports of infrequent bowel movements and abdominal distension. The nurse should assess Tanner's typical defecation habits and tell him that he should go to the restroom as soon as he feels the urge. He also needs to incorporate at least 20 grams of fiber into his diet and be sure to drink plenty of water, 1.5 to 2 liters a day. Tanner should also avoid narcotic pain medication, as this would make his constipation worse. This is why he's told to take an over-the-counter pain reliever, and he's not given a prescription for a narcotic. Tanner's diet also needs to improve. He has deficient knowledge related to dietary requirements of fiber, fruits, and vegetables, as evidenced by stating that his diet consists mostly of bread, meat, potatoes, and ice cream. So he needs to be taught to decrease the sugar and carb and fat intake and increase fruits and vegetables. He also needs to avoid seed, nut, and kernel type foods for a while because those could easily get lodged in diverticula, contributing to the inflammation that exacerbates diverticulosis into diverticulitis. Exercise. Tanner has a sedentary lifestyle related to deficient knowledge of health benefits of physical activity, lack of resources, and lack of motivation, as evidenced by his stating that he does no regular exercise because he has no time. So Tanner should be encouraged to participate in an exercise program, and he needs to build bone and muscle strength. He can start out easily by walking and then gradually add some resistance training. The exercise will increase peristalsis and decrease his constipation. And also, he could look into getting a fitness app that tracks his steps and activity levels every day. We also thought that Tanner just had a general knowledge deficit about wellness. He has deficient knowledge related to lack of exposure and unfamiliarity with information or resources, as evidenced by poor diet, mild obesity, and smoking. So one suggestion is that he should create a journal of his food intake and utilize the USDA Super Tracker to determine areas of his diet that need improvement and to find out what he can consume to remedy those deficits. And there's the website he can go to. Tanner should also keep track of his bowel movement pattern for a week, including time, consistency, difficulty, and his fluid intake. And he should really contact his health insurance to find out what resources are available to him for smoking cessation. Most insurance plans cover stop smoking treatments. And finally, we can give him information about different types of physical activity and the benefits of each. As we mentioned earlier, Tanner smokes. Smoking is a risk factor for diverticulitis. It's also connected to several other health conditions such as stroke, heart attack, pulmonary issues, and it would really be good for his overall health if he could stop smoking. Finally, we want to talk about colonoscopy. The American Cancer Society recommends that you have a colonoscopy every 10 years starting at age 50. Although if risk factors exist, such as a family history of colon cancer, the screening should take place every 5 years. We know from the family history section that Tanner lost his father and an elder brother to colon cancer, and that increases his risk. So Tanner should have a colonoscopy if he hasn't had one recently. Hopefully in this case, the colonoscopy will go well, and with the anti-infectives and the bed rest, Tanner should be feeling much better very quickly.